All right, welcome everyone. My name is Lynn Kinst. I am the Executive Director of the Hemophilia Council of California, and want to welcome you to our webinar this evening, How to Advocate Like a Boss. We are glad to have you joining us.
I don't even know I'm attending a meeting, but I'm with you. There should be a chat.
So, yeah, sorry. So folks, if we can go ahead and mute everyone so that folks can hear, and we'll go through a few instructions. So again, we had a few interruptions there. I'm Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California. We wanted to welcome you to our webinar this evening, How to Advocate Like a Boss. And we are going to be mostly focused on preparing folks for our legislative day, which is rapidly approaching. It is coming up on Monday, and we have been scheduling all kinds of meetings. So very excited about that. But do not leave us if you are not joining us on Monday, because we will be giving you some tips about how you can participate in our advocacy efforts, even if you're doing that from home. So with that, let's get started. We want to make a quick thank you to our sponsors, Takeda, Sanofi, BioMarin, Novo Nordisk, the Hemophilia Alliance, AbbVie, our excellent sponsor, Genentech, and then recognize that we are providing Spanish translation with support from Takeda and Bayer. So with that, just briefly, I'm going to guess that most of you are here today because you're already familiar with the council, but we are a statewide advocacy organization that's focused on access, education, and advocacy on behalf of individuals living with bleeding disorders, as well as other chronic and rare conditions. And we seek, as part of our mission, to really improve access to care and treatment options to advance the quality of life for people with bleeding disorders through this advocacy, education, and outreach. And we do that in collaboration with the local bleeding disorders organizations in California. So coming up tonight, we're going to cover a few things. We're going to talk a little bit about our bleeding disorder story, although hopefully some of you joined us for the webinar that we had last month, which was really focused on that telling your story. We're going to spend a bit of time, and that's what we're going to come up with next, is focusing on AB 2180, which is the bill that we are focusing our advocacy on this year, which is there to protect patient assistance programs. And then we're also going to talk a little bit about our second ask, which is encouraging legislators to continue full funding of CCS, GHPP, and Medi-Cal. So with that, I would like to introduce my dear friend, Siri Vaith. Siri is the Executive Director of the Cystic Fibrosis Research Institute. And she and I together, along with the Rheumatology Alliance, the ALS Association, and the Cystic Fibrosis Research Institute, or excuse me, the Cystic Fibrosis Foundation, are the co-sponsors of AB 2180. So Siri, do you want to take it over?
I will. Somebody unable to start video? Can't start your video, doesn't matter. I don't need to be seen. You can hear me, right? Oh, here we go. Let's see, there I am. Hello, everybody. And Lynn, you had it right the first time. I am with the Cystic Fibrosis Research Institute. So just want to clarify that, and it is an honor to be here. We have worked together so closely. I think Lynn and I feel like we're joined at the hip these days. I've been at so many meetings, but we are our disease groups, and we're both rare disease groups, but we share so many of the same burdens, and in particular, burdens related to copay assistance and access to therapies. So I am very happy to be here to talk about this. Now, I know Lynn has done an amazing job keeping everybody up to speed, and this is just probably going to be a huge repeat for people, but just so that it's all fresh in your minds before Monday, copay accumulator policies are now embedded with almost half of the insurance plans, commercial insurance plans in California. And what they do is allow payers or pharmacy benefit managers to basically double dip and receive 2 payments for a prescription. Well, how do they do this? If a person with a bleeding disorder or a person with cystic fibrosis has a prescription, and we all know that our therapies are very expensive and hard to access, if we receive patient assistance, whether it be from a private foundation or from a manufacturer, historically, for time immemorial, that assistance, which you have to qualify for, ends up being applied to your deductible and your yearly out-of-pocket expense. And so for years and years, you would receive this assistance. It would be this wonderful bridge for us to pay down the deductible. And then once the assistance is used up, because there's very rarely any kind of infinite assistance, you would have walked across the bridge and now you just have your copay, which typically is far more manageable. And I do know from Lynn that it's, very challenging for people in the bleeding disorder community, because it isn't just about copays for drugs and a pharmacy benefit. This is now becoming 20% or what have you copay for a medical benefit. So if you have any assistance, typically you could use that, would be applied. In recent years, insurance companies across the country, and in fact, across the US, 2/3 of payer plans have these embedded within them. And basically they say, yes, thank you so much for that patient assistance money. We'll take your money and here are your medications or your therapies. But as they take those funds and those funds are fully expended, you then have not applied they have not applied any of that money towards your deductible or out of pocket. And so right when you think you are now in the sweet spot and you'll be able to access your therapies with your copay, instead they're saying, oh no, your clock is actually starting right now and you owe us the full amount of your deductible. And so that's why we refer to it as double dipping, because they are accepting money and then they are requiring that same amount of money once again from the patient. And so this ends up increasing patient costs significantly, while obviously insurers and PBMs are doubling their profit. And so we are very fortunate this year that Dr. Akilah Weber from San Diego is again sponsoring legislation to ban this egregious practice. So it's AB 2180, just imprint that in your brains. And it will ban the use of copay accumulator policies and require health insurance plans to apply those amounts paid by the insured, no matter where that source is from, to the deductible or out-of-pocket maximum. Now, last year, I know Lynn did a whole training on this. There was a different piece of legislation that did not advance for reasons we don't need to go into right now. This year, we have really strengthened the language, narrowed the focus so that it is clearer for all parties involved. This is not legislation about discount coupons. If you're in a meeting and somebody says the word coupon, you just need to clarify, this is not about discounts. This is not about coupons. This is about assistance, financial assistance that you must be eligible for that is applied. And this year is applying specifically to people with chronic and terminal diseases, which, chronic, the definition for us being a condition that is lasting for about a year minimum. So, and then you can see all the co-sponsors that Lynn had mentioned before. So I think we can go to the next slide. So myth versus fact. Here's one of them, that this is all about patient steering. Now, this is an argument that opponents, typically insurers and PBMs, are using in California where it has absolutely no place. It's like, this is the national argument, but in California, it has no place at all. We already have pre-existing legislation that says that it cannot be applied should there be less expensive generic equivalents. So this is not steering anybody to some expensive name brand that has a generic equivalent. And hello, bleeding disorder community, CF community, we are rare diseases. There are 10,000 rare diseases. Only 5% of those diseases have an FDA approved therapy. And so we are very fortunate. We're in the little few that actually have therapies, but we have no generic equivalents. So that is just a complete myth that has no place here. Let's see. So I've already mentioned about 50% of the plans in California have these included in the policy. Many people may have them and not know that they have them because there has been no obligation to let people know that these have been added to their policies. And so for most people, they learn this is in their insurance plan when they go to pick up their medications and are told they have to pay the full price because none of that previous assistance has been applied to their deductible. So, you know, in the CF community, we call it the spring surprise. And it ends up, what is the result of that? Patients being forced to walk away without their medication. And for those who are able to access them, people who are more likely to not adhere to the proper prescription of that therapy, they're going to start dosing every other day instead of every day, what have you, to try and stretch it out because the expenses are so astronomical. I think next slide. So here is what we know. It certainly exacerbates health disparities. We know that when out-of-pocket costs reach $75 to $125, 40% of people are going to decide that is too much, that is unaffordable. When out-of-pocket costs reach $250, over 70% of patients do not access their therapies. And I want to add, in California, we are, you know, one of the lucky states, and that we do have legislation from years ago that keeps a cap on patients' copay, consumers' copays, to $250. So I can tell you, compared to many of my friends in other states, that's a wonderful protection. But I can also say that that adds up very quickly. If accessing one $250 prescription is going to make 70% of people despair, if you have, like my daughter at one time was on 5 specialty medications, that's a lot of money. So we know what happens when people skip their doses. In your community, my community, it ends up more or need to be hospitalized for 2 weeks with IVs in our community. It leads to greater risks of health decline and very costly emergency room visits. So right now, total of 19 states, Puerto Rico and the District of Columbia have passed legislation. Oregon has as well, and we are just crossing our fingers that the governor signs it. There are no signs, right, Lynn, that the governor would not sign. So hopefully that is forthcoming soon, and we can say a total of 20 states. And the reason this is important to note is that, well, first of all, look at those states on the map in purple, and you can see this is a very bipartisan mix. These are blue states and there are red states there. So this is an issue that really, you know, doesn't discriminate based on political party for sure, and that everybody should be getting behind. So that's one thing to note from this map. The other thing to note is that a huge argument, you know, the myth fact thing we talked about before, is that if we were to have a ban on copay accumulator policies in California, it's going to raise premiums, it's going to be horrible, it's going to cost everybody so much money. Well, while I'm sad that we still haven't passed this legislation, at least now we have all these examples in front of us. And what we have learned from those states is that this does not raise premiums significantly. And in fact, likely, you know, is going to save money when you think of what happens when people adhere to their prescribed therapies. Next slide.
And we will keep it tomorrow.
So we need this legislation in California. We also need it at the federal level. And, you know, just as like a simple example, if if a person lives in a state where there is a ban on these policies, but their employer is a national employer and their healthcare is maybe based out of a state where they do not have it, they are then falling victim to that policy. We need to have federal legislation and state by state. There are efforts there. So something just for you all to follow and plug in and advocate for as well. There's a House bill, there's a Senate bill to help ensure lower patient copays. So with that, was that my last slide, Lynn? Oh,
Almost.
Look at this beautiful
Yeah.
picture. Feast your eyes. This just shows the amazing support from patient advocacy groups, also provider groups that really know what a hardship this is creating for patients. And Like one of our partners, co-sponsors, is with the Rheumatology Alliance. That's a group of providers who are extremely frustrated by how many of their patients are ending up in the emergency room for pain management because they have had a hard time accessing their prescriptions. So this is a great list, and I'm really honored to be working with you, Lynn, and the Hemophilia Council to move this legislation forward.
Thanks, Siri. So I'm going to pause right there and open it up for questions. We have some other topics that we're going to talk about, but I know Siri is going to have to jump in a minute, and so I want to see before we jump onto those additional topics if anyone has any questions. We have been talking about this issue for a while, but I know that there are some folks joining us for Ledge Day who haven't been with us for Legislative Day for a while. So this might not be new to you. I know on the other hand, we have folks that are joining us on Monday that were in DC with me last week, where we were advocating for the federal bills. And so, you know, you guys are all queued up and ready to go. But we just have to remember the different bill numbers. But does anyone have any questions about the bill or what we're going to be talking about when we talk with legislators on Monday? Feel free to unmute or raise your hand or put it in the chat. I guess we did a good job explaining it because I'm not seeing a bunch of questions pop up. I guess it's also the advantage of having to run the bill more than one time. So the positive of that is that we're getting familiar with the issue.
And you know, the last thing I'll say is when you do talk about it leading to greater costs, I mean, there are so many studies now that show what happens when people are not able to access therapies and do not adhere to the way they are prescribed, their prescribed use. There's 120,000 people dying. There's savings in billions of dollars when people do adhere. So all of that information, those of you who are really into the stats, I'm sure Lynn could hook you up with those.
Absolutely. Absolutely. Well, thank you, Siri. We're going to jump on to the next part of what we're going to be covering, but I know how busy you are, and I appreciate you taking time to join us tonight and help us prepare for Monday. So.
Well, thank you for inviting me, and thanks to everybody here who is advocating for this important issue. We're all in it together.
Yes.
All right. Bye.
Bye. So now that we've talked a little bit about the bill and AB 2180, we're going to continue on here. And really, we went slightly out of order because just of Siri's availability this evening, and I wanted to have her have a chance to share a little bit about the AB 2180. But in practice and in reality, when you go into your meetings on Monday, we are going to start really with introducing ourselves and talking about what it means to live with a bleeding disorder, and sharing a little bit of our stories. So just a couple of pointers that I wanted to raise about explaining the bleeding disorder. You know, we want to use simple terms, right? We want to avoid jargon and acronyms that people won't understand. Anybody want to, like, maybe in the chat throw out some examples of some acronyms that we would commonly use in the bleeding disorders community that staff in the Capitol may not be familiar with? There's a good one: HTC, right? Prophy, GHPP, even though that's a state program. Not all the staff, and we'll talk a little bit more about this, but not all the staff in the legislature are going to be familiar with it. BWD, LEADS, right? Factor, that's good too. They probably don't just know what that is based on shorthand. So it's okay to use some of those terms, but, you know, go ahead and say the full term. You know, instead of saying HTC, say a hemophilia treatment center. Instead of saying HCC, say Hemophilia Council of California. And obviously, as you're talking about, you know, bleeding and hemophilia and von Willebrand's disease, we can share those with a greater explanation. Then we also want to personalize our stories, right? By talking a little bit about exactly what it is to live with a bleeding disorder. And you can go ahead and do that in the context of how it impacts you personally or your family member. I know not every person that is attending Legislative Day necessarily has a bleeding disorder themselves. Maybe you have a parent or a sibling with a bleeding disorder, but you can still tell that story by sharing what you have observed from your family member and how it's impacted their life. And then sometimes it's helpful to address common misunderstandings, right? I mean, it's sort of the, oh, if you have a bleeding disorder, you're going to bleed to death from a paper cut, right? Like, we're not primarily worried about paper cuts. We're worried about internal bleeding, joint damage, brain bleeds, other things that are, more likely to be potentially life-threatening or cause significant, ongoing damage to our joints or our bodies. And so as we talk a little bit more about that, and before we get into the budget, I want to introduce Carson. Carson, are you able to unmute yourself?
Yes.
There you are. Excellent. So Carson is going to share a little bit about his story and then talk a little bit about what it is to, how to prepare for these meetings that you're going into. And I'm not going to steal your thunder, Carson. So I'm going to let you explain why you are now an expert on speaking to legislative staff.
Okay. First off, hi, my name is Carson. I'm happy to say there's a lot of familiar names here, not a ton of familiar faces because all of us have our cameras off, but that's fine. We're all here and I appreciate that. In terms of, I would not consider myself an expert talking to legislators, but I do have a lot of experience with it because I actually work in the Senate. And I won't give too many details, but I'll probably meet with at least one of you on Monday, so I won't spoil that. So my story on how I got into this and sort of how that's influencing what I do now. So I have severe hemophilia A. I got involved with Future Leaders with the HCC when I was like 14, something like that, like my freshman year of high school. I did it for years after that when I graduated college or high school, and then we had a global pandemic not long after that. I got involved with HCC's Advocacy and Access Ambassadors in its first class, and I am still doing that. And so I got to work on a lot of advocacy efforts outside of just our usual, our Future Leaders in our legislative day that happens once a year. We get to work on some things that are going on year round and try and make sure that politicians at every single level, whether it's city or county or state, are still aware of bleeding disorders. I can say from, working with a legislator that they have so much stuff going in one ear and out the other all the time that if you don't keep saying it, they won't remember it. So it's why it's so important that we're here at least once a year so that we can be there and bring it up to them and put a face to a name and shake their hands and tell them our stories. So my personal story, I like to say that I was very fortunate that I don't have a really impactful and emotional story. I was raised with great access to medical care. I took care of myself. I've had lots of big bleeds, but I think a lot of us have. But I got to be a great success story for what the state of California can do for people that live with rare medical conditions. And so I have just a few tips on how to talk to legislators. And Lynn, if you have anything else that you would like me to speak to, you're more than welcome to jump in on that. The first thing I would say is one of the first things that Lynn said, which is don't use acronyms. Just today, I think I've been told maybe like 25 to 35 different acronyms on like all different like issue areas, whether it's like stuff for transportation or things for healthcare or insurance. And there's so many different things. And the senator or the assembly member or even their staff are being hit with all of these like acronyms and these numbers and these figures and these dates and all of this all the time. So as much as they probably know a whole lot about, health, if you're meeting with their staff person that works on their health legislation, It is always great to keep it in as simple terms as possible. If they want some more complicated information, they will probably ask. Another thing that I'm sure most folks have heard before is if they ask you a question and you're not super sure about the answer, you're not like 100% on it, tell them that you don't know and make a note of that question and tell Lynn so that we can follow up, because it's better to just be honest and say like, I don't know, but we'll get back to you with it, because you'll get their contact information, than to give them an incorrect figure. Because if you're meeting with a staff person, they're going to take a lot of notes and things like that. They'll take whatever leave behind documents you give to them and they'll write all that up and they'll give it to their boss to tell them about your meeting. So if you give them a wrong number, you don't want them to be like giving that incorrect number to somebody who's going to have to vote on something, because you never know how that's going to affect people. And yeah, I would say my last piece of advice that I have found to be essential is to remember that everybody you're meeting with, whether it's a staff member, whether it's a senator or an assembly member, whether it's the governor, which I don't think we're meeting with the governor, but even if you did, all of us are human beings and they're very normal. And half the time when I've met with groups, I'm just as nervous as that group is, because I know that they know more than I do about the issue. And that's something that you'll probably see a lot of. I know we usually open with the question, what do you know about hemophilia, or what do you know about bleeding disorders? I would say most offices are going to say not much. And that's going to be true for most of what you're talking about. It might be the first time they're hearing the bill number that you're telling them, unless you're in Assemblymember Weber's office because she's authoring the bill. I would hope that they know it then. But pretty much everything you're going to be telling them is probably going to be the first time that they're hearing it, unless they saw you last year, in which case that might be fun. But yeah, I would say just remember that we're all human beings, and it's good to take a few deep breaths before you go into a meeting. But I promise they are not super important, high and mighty people. I haven't met somebody that's all, self-important or that's going to stress you out in a meeting. They're there to take notes and they're there to learn a whole lot about what you have to say, because they want to make sure that they're supporting good bills, and that if there's some bad bill that they know about that too. And I'd like to say that the bill that y'all are working on is a good bill, and so they're just there to learn about it. But yeah, Lynn, I don't know if you have anything else that you'd like me to answer, but I'm happy to answer any questions that people have.
Yeah, let me go through a few items, and Carson, if you can hang with us, and then, folks can ask either of us questions that they might have. So I'm gonna kind of transition into some of the logistical pieces, because I think sometimes understanding like how it's gonna work is one of the things that can kind of help reduce our nerves, right, when we're going into something like this. So you'll be getting an email from us either tomorrow or Friday with a little bit more information about the schedule. But we're going to be meeting together on Monday morning at the Secretary of State's office. We have some meeting space reserved there on the first floor. The great thing about that building is it's right across the street from the legislative swing space, which is where most of the legislators' offices are now, and where almost all of our meetings will be. There are maybe like 2 meetings, I think, where we go to the legislative office building or the LOB, which is kind of around the corner from where the swing space building is. But this will be, for those that were there last year, we were kind of far away from the building, and that wasn't the most convenient. And the weather was bad. The good news is we're going to be super close, and the weather looks like it's going to be really nice on Monday. So those are both, helpful things when you're having to walk around between buildings for meetings. So in that email that should watch for from us, we will get you copies of the materials that you're going to be able to be talking about and sharing on Monday, so you can read those in advance and practice your story. Business attire is appropriate for these meetings. And we did mention, bring your red tie or scarf. Many of you might be familiar that as part of Bleeding Disorders Awareness Month, which the resolution from the state that Carson's actually been helping to work on this year is going to be should be on the Senate floor tomorrow. So they will have heard that right before we get there on Monday, which is exciting. But we've often used the red tie to symbolize Bleeding Disorders Awareness Month. So we do encourage people to, you know, wear a red tie or a scarf, or maybe wear red clothing of some kind as part of your attire. It's not required. It is just something that we encourage. And I would encourage you, if you're planning to wear a red tie and you already have one, please bring the one that you have, but we will have some available on hand if you don't have a red tie and you want to put one on at the event. And then there will be a bit of walking. So even though it's a little bit more business attire, you know, try to wear a little bit more comfortable shoes so that, you know, you never want to wear the brand new fancy shoes to an event like this, because you're liable to end up with blisters walking around so much and standing on your feet. So wear comfortable shoes. There are 2 points at which you will go through a form of security. So entering the Secretary of State's building, you will go through security guards. You have to sign in that building and show a photo ID when you sign in. But there is not like an actual like screener for that building. And then when you go across into the legislative office building, you will go through security that is much like the airport. You know, you go through the metal detector and your bags will go through the machine. The 2 things that are different that I always say is they don't make you take your shoes off, and you can bring your bottle of water with you, which is sometimes nice to have when you're going into the building. So you don't have to worry about like throwing your water away like you would have to when you're going through airport security. But you don't want to bring, you know, a pocket knife or something with you, because that they will not allow through the security, for example. So, so be prepared, photo ID, as well as your fact that you will be going through security. And then you're going to arrive early. We're going to encourage you to go across to those meetings early. Sometimes the line can get long entering the building, going through security. And then, you know, it can be a little bit crazy getting lost. Carson mentioned in the chat, yeah, belts, metal watches, things like that, they might ask you to take off as you're going through, similar to the airport, but not usually shoes. And again, water or drinks or snacks is fine. And then, you know, we always say, like, please don't be late for your meetings. But at the same time, you know, we do know that sometimes something unavoidable happens. We tried not to schedule everyone too close together on their meetings. But if you get delayed in one office and it makes you late for another, you will have a list and contact numbers for that office. So you can call and let them know that you're on your way, but you're running a little late. Then once you get to the office, make sure that your entire group has arrived, and then one person can check in at the front desk. Many of the meetings on Monday are going to be with staff. We always remind everyone, never say, oh, we're just meeting with staff. Like, let's not offend them before we have the opportunity to talk to them. It's not uncommon for staff to have more expertise in the policy area that you're meeting with them about. And, you know, they are the one that's going to be briefing their boss. And so it's very valuable to brief them. And oftentimes you get to know them year over year. If you continue to come back, you might end up meeting with the same staff person, you know, multiple years in a row, and they really begin to learn you and your issues, which is really, really kind of exciting. The All Copays Counts Coalition, we were having meetings with some Assembly Health staff. And when we went to meet with one at the beginning of this year, he was like, oh, I remember this from last year. He was like, I think you guys had kind of a slogan or something. Wasn't it like, all copays count? We were like, yeah, all right. He remembers the issue. So it's a nice thing to be able to build those relationships. So nobody will be taking any meetings completely by themselves. You will be in a group with probably 3 to 5 other people. And all of the groups will have at least one person that is an experienced advocate with you that will kind of help guide you through the process if you're new. We always encourage everyone to introduce themselves in each meeting. But we try to let the constituent, the person that actually is represented by that member's office, kind of shine in the meeting. And in addition, we always want to give our future leaders an opportunity to take into practice what they've been doing, because they will be coming to Sacramento starting on Saturday, and they'll be spending a lot of time working on their stories and preparing. So we want to make sure that they also will have an opportunity to introduce themselves. And I think the way that we've worked it out, there's at least one future leader in every group this year. And so when you're in those meetings, use persuasion and not confrontation as you're talking to them, and really stick to the issues which we are presenting. So everyone signed an agreement when we were coming into this saying, hey, I'm going to focus on the HCC policies. And so we'll make sure that we do that on Monday. One of the last things that you're always going to want to do before you leave, and you're always going to want to ask permission first. In the vast majority of offices, this will be fine, but there could be a situation in which for some reason they don't want you to take a picture. So always ask before you start taking pictures. But typically we will take a picture with the office, either with the legislator or their staff, and who we were meeting with, and then we can use that to give them a shout out on social media afterwards, thank them for their time, remind them about the issue that we were meeting with them on. And then Kirsten already mentioned this one, but it's one that bears repeating. If you get a question and you are not sure what the answer is, do not ever feel like you should make up a response to a question. It's perfectly appropriate to say, you know what, that's a really good question. Let me write that down and we will get back to you. And then you can bring that question back to me. Andrea will be there in the meeting space. And you can bring that back to one of us, and we can get back to that office with the answer. In many cases, someone in your group will know the answer, even if you're the one speaking and you don't individually know the answer to that. But if no one knows the answer, that's totally fine. And it just gives us an opportunity to follow back up with that office and maybe have an additional conversation with them. So I want to pause with there and see if we have any questions about what we've covered so far or comments. Okay. So let me go back real quick because I skipped over the budget issue. So I want to spend a little bit of time talking about that. So the second issue after the AB 2180 that we're going to talk about is just supporting funding for CCS, GHPP, and Medi-Cal. So I just did what we told you not to do, right? And I used some acronyms. So can anyone tell me what CCS or GHPP stand for? Anyone know? I'll give you a clue. It's on the slide.
California Children's Services and Technically Handicapped Persons Program.
Awesome. Thank you, Meredith. Yes, so we are going to be advocating for full funding for California Children's Services and for Genetically Handicapped Persons Program. I will tell you, particularly if you're talking to health staff, they will almost certainly be familiar with CCS and California Children's Services. They may or may not be familiar with GHPP. Just to give you an idea of the scale, there are somewhere around 16 million people maybe on Medi-Cal in California, around 200,000 on CCS, and only 1,500 people in the entire state on GHPP. So in the scheme of programs, GHPP is pretty small, although it's incredibly significant and important for all of those that can benefit from it, right? I also want to assure everyone that despite the sort of grim state budget outlook this year, the governor's proposed budget does have full funding for those programs currently in it. But we always take every year as an opportunity to advocate for those programs, because we always know that when we're having difficult budget times, that could be something that could get kind of put on the chopping block, cut back. And so we want to take every opportunity that we can to make sure that legislative staff and legislators are aware that the value that these programs bring. So it is likely, although not a guarantee, but it's likely that someone in your group has benefited personally from one or both of those programs in the past or currently, and they may be able to speak to it from personal experience. You will have time on Monday morning to interact with your groups before you head over to the Capitol. And so you'll be able to kind of work out, you know, who has what story to tell and maybe who is going to focus on which policy area. But just keep that in mind, that essentially, you know, personal stories of how these programs have really helped you to be a more, you know, successful, engaged citizen of California are beneficial for legislators to hear those stories and to hear thank you from us, right? Thank you for these programs that are so beneficial, because GHPP in particular is something that, you know, is really unmatched. And there are no other states in the country that have, you know, such a robust safety net for their bleeding disorders population. So any questions on the budget items that we're going to talk about? Okay. All right. So with that, I'm going to go to just like some wrap up thoughts here. Things to keep in mind. Carson said this basically, right? Legislators and staff are people too. Don't feel like you need to be intimidated. Look for different ways that you can connect, particularly if you're from their district and can give a shout out to like a location in their district or something that you know that they've done. That can be a great way to connect. But they are there to listen and learn, and they want to hear your story. But be respectful for their time, right? Like most meetings are going to last 15 to 20 minutes. If you get a whole half hour, like, you know, you got extra cherry on top of that meeting. And so, you know, you're going to have to think about how to concisely tell your story and give more than one person in your group a chance to speak. After your meeting, so we do have a list of who we anticipate that you're going to be meeting with. Sometimes that will change at the last minute. Most of the time, it's pretty rare for a meeting to be completely canceled at the last minute, but it's possible that they might have to, you know, have one of their colleagues in their office take the meeting in their place. So if you're currently scheduled with a member, something could change and they might have to have staff meet with you. Or if you're scheduled to meet with staff, if something changes at the last minute, the staff gets called away, they might have one of the other folks in their office meet with you. So make sure you get at least one person in your group gets a business card of the staff person that you met with, so that you and they can follow up, or you and the group can follow up with them, and we can follow up with them as well and know who we actually met with. Use your photos to engage on social media. And the main hashtags that we're going to use are HCC Legislative Day and All Copays Count. And then afterwards, we will have you report, the group leaders will work with us to report back like any important things that you learned in your meetings, if anyone committed to support the bill, if there was a question that we need to get back with. And then at least one person from each group should send an email or a handwritten note to say thank you and to make sure that they just are reminded of the information that you shared. So those are kind of the key follow-ups. We will send out, and Andrea put this in the chat as well, we are going to be providing you with handouts that include sample social media folks and, you know, sample social media, sample letters, etc. We also, I know I've gotten some questions about, you know, the list of who you're going to be meeting with. We will be providing you the list of your meetings on Monday morning, and you'll have copies that you'll be able to take with you. And the reason we don't give it out further in advance is just because things often change at the last minute. We're still doing we're still getting responses in some cases from our meeting requests, and you know, we might have to shuffle things at the last minute. So we will have that for you on Monday morning. And then again, if you aren't going to be able to be with us, you can still participate. You can send an email to your assembly member and senator in support of these issues. You can engage in social media, and then you can follow along with us on social media and see what we're doing. So if you do not receive the information, we will be posting all of the handouts and the social media on our website. But if you can't find it, feel free to email Andrea or I, and we will get you a copy of that information so you can participate. A couple of social media sort of tips and tricks. I can't say that apparently. So you want to use a photo to grab attention. That's always helpful. If you are participating in Legislative Day and you have actual photos from the day, that's ideal. We have 2 graphics in the toolkit that we'll be distributing. And so you can use those graphics as well or create your own to make that easier if you're not going to be in person participating. It often helps ahead of time to follow your legislator on their active social media platforms. Most of them use Twitter, Instagram, Facebook, and or LinkedIn, some combination of the above. So if you follow them before Legislative Day, it will make it easier to do your posts and tag them on Legislative Day. And always be respectful in your social media posts and assume, even if you think you've set your posts to something more private, doesn't necessarily mean that people can't get access to things. So always write your things in a way that you assume that they're public, and you want them to reflect well on yourself and the rest of the bleeding disorder community. So even if you had a bad meeting, which is rare, and I don't want to scare anybody because it's pretty unusual to have a bad meeting. Most of the time people at least listen respectfully and engage in conversation, even if they, for whatever reason, don't agree on all of the issues. You always still want to be respectful and positive in any social media posts. And then again, there are the Hemophilia Council handles. You can follow along with us, share our posts, and check out the toolkit for more ideas. Any questions on social media? Okay, well, we have just a few more minutes, and I do want to make sure that if there are questions, I can stick around here for a little bit and answer them, but we want to thank all of you so much. We have nearly 50 people that will be participating on Monday, which is amazing and awesome, and we're thankful that you're going to be joining us. We're thankful that you joined us tonight to learn more. We want to, again, thank our sponsors for making our webinar series possible. And thank you all for joining us. And please, if you have any questions, feel free to stick around. I'll stay here for a minute and answer any questions that anyone has. But look for that email from us on Friday, either tomorrow or Friday. And we look forward to seeing everyone on Monday. Thanks for coming tonight. And again, feel free to unmute or put it in the chat if you have a question.
Thank you.
Thanks so much. Bye, Randy. We'll see you on Monday.